Kelly. Kelly, I did give permission to record. Can you guys all hear me? Yep. Hello? Still. Hello? Still doing it. I don't know how to turn this on. We do this every stinking day. Okay. Gosh. Okay, plan B, I'm gonna use my laptop. Okay. Can you guys all hear me now? Yes.
From KREM 2, this is breaking news.
Breaking news here at 11:15. The Spokane Regional Health Board is meeting right now to discuss their decision to ask our area's top leading health expert to step down from his position. Thank you for joining us for special coverage this morning. I'm Joshua Robinson. This morning, the department told us that Dr. Bob Lutz is being asked to resign. They have not said why that decision was made, but they're meeting right now to talk about it with the public for the first time. Let's listen in.
We're here to discuss the health officer announcement that was sent out earlier today. As the administrative officer, everyone in the agency, including the health officer, reports up to me. To clarify, rather than a decision, a discussion was had during the executive session of the Board of Health meeting regarding performance concerns of the health officer. The executive committee gave me their support to ask for Dr. Lutz's resignation. There is no denying Dr. Lutz's commitment to the well-being and health of each and every member of our community. His knowledge of COVID-19, how the virus spreads, how to slow and prevent transmission, and guidance based off of that knowledge is sound. Here at the Health District, we will continue to stand by that guidance going forward.
Hello, I'm Ben Wick, Mayor of Spokane Valley and Chair of the Board of Health. Board of Health fully supports the actions taken by Amelia. Although we cannot discuss personnel issues, I can assure you that the discussion or the decision was difficult and not made lightly. We cannot specify any details, but there was valid reasoning behind these actions. I want to reiterate that the guidance we've received from Dr. Lutz regarding our recovery efforts during the COVID-19 pandemic are based on the data and are evidence-based. We will continue to follow these guidance and use the same criteria for providing guidance throughout the remainder of our recovery efforts.
Thank you. Now, if you have questions, please state who you are and what publication you represent and who you're addressing with your question.
Good morning. This is Mayor Golosh with KXOY News. So You guys didn't actually say it. Is Dr. Lutz officially resigned?
Hi, thank you for that question. The date was effective yesterday.
And who's going to replace him?
We are in the process of putting together our recruitment plan to hire another health officer. At this time, we do have folks internally who can help cover some of his duties and have also reached out to the state.
And why is this coming now as cases are rising during this COVID-19 pandemic? Are there internal issues that cause this?
You know, SRHD is made up of an amazing team of people who have all been working tirelessly throughout the pandemic to help the community stay healthy and to save lives. Our recovery teams have strong relationships with community partners and will be able to continue to respond and lead to the community through the pandemic.
This is Sam Wolfile with the Inlander. Can you please clarify, you said effective yesterday. Was that effective yesterday that you were asking Dr. Lutz to resign, or his actual termination was effective with a Board of Health vote at that time?
So again, the Board of Health did not vote on that. It was from a discussion had during the executive session.
So is he officially no longer an employee, or what is the official status as of today?
So again, you know, this is a personnel issue, so I cannot go into details.
How long has this decision been brewing or being discussed among SRHD?
Can you tell me which publication you're from, please?
Yeah, sorry, this is Mayor still from KXOY.
Hi, okay, thank you. Again, you know, I think that's a personnel issue that we're not really going to go into.
This is Casey Decker from Creme 2 News. I'm sorry, did you just say that you can't even tell us whether or not he currently works for SRHD?
No, what I asked, the question that I heard was if I can give, like, if it was a culminating issue. That was the question I was asked.
Okay, I heard the reporter from the Inlander ask for clarification on at what point did he actually step down or was he terminated? And I'm still looking for clarification on that as well.
Okay, my apologies. I thought that you meant from the last question. So yeah, it was effective yesterday.
What? Sorry, this is Sam from the Inlander again. What was effective yesterday?
That Dr. Lutz is no longer the health officer at the health district, starting today.
This is Ariel with the spokesman. Was Dr. Lutz asked to resign and he resigned, or did you terminate him on a recommendation of the board?
You know, because this is a personnel issue, I'm not able to go into that question.
So you can't tell us if he was terminated or if he resigned?
So, you know, at this point, under advice of counsel, I really can't go into details regarding that.
This is Mayor with KXY. This is public information that is out there, and we need you to cite the RCW that is not allowing you to release the fact that if he was just terminated or if he had to resign.
Okay, I'll have to get back to you.
Amelia, this is Melissa Luck from KXLY. The community right now is responding. There's an anti-mask. There's people who don't trust public health, who think they won today. I think part of it is the messaging this morning so far. But can you help us understand how the community should trust the health district when they've been told to trust Dr. Lutz and now Dr. Lutz is gone?
You know, I think that with our response to COVID, you know, our incident command system has been in fully activated for response and recovery since the beginning of the pandemic. There have been a lot of people involved in the response. Like we mentioned earlier, the guidance that we have been using here at the health district aligns with the state guidance. So we have been using that in, our messaging and in what we have been working with the community on. So I think that still remains.
This is Ariel with the spokesman again. Who is our current health officer in Spokane County that will be representing us at calls at the state level and coordinating our response?
So currently there is not one.
And how long do you plan to have that position vacant? And what does the process look like for getting the next person in there?
Yes, so I will begin the recruitment process to join the SRHD team as soon as possible. We know that recruitment of health officer positions can take time. When a new candidate is hired, we will send out additional communication.
So do you plan to hire an interim or just leave that open until the formal process is completed?
Yes, we will. I am actually currently working to try to find someone who can help us via contract, but would not be a permanent replacement until we can go through the full recruitment process.
Amanda Rowley here with CREM. We were looking through the district's bylaws this morning, and it says if there's a vacancy for this position, the vice chair would take over as acting health officer. So would that be the case, or you're saying no?
I would need to look at that the vice chair, you're saying
the vice chair would be the acting health officer.
Jesus, God help me.
Is it?
I need to go back and check that in the bylaws. But at this time, we will be using our incident commander and that, which is Lindia Wilson, who's been leading this. She's our division director of preventive public health, works very closely with the epidemiologist. And I'm sorry, the person that asked the question about the vice chair, can you, because I maybe need to reach back out to you.
Yeah, sorry, I don't know if you heard me. Amanda Rowley with CREM 2.
Thank you, Amanda.
Happy to email you your bylaws.
No, I have the bylaws. I just will double check. Thanks.
Okay, thank you.
Hi there.
Amelia, this is Whitney Ward from CREM 2. Oh, sorry.
No, it's okay, Whitney. You go for it. You're an OG. Go for it.
I just have a quick question for you, Amelia. How do you justify getting rid of the health officer in the middle of this global pandemic when our local cases continue to spike?
The decision to ask for the resignation of any employee is never easy. And in the case of a health officer, it's never going to be easy. And, I, again, had the support of the board in doing what I needed to do.
Was it for professional reasons or personal reasons?
I think, again, that kind of falls into personnel issues that I can't discuss.
Do you not find it odd that you're not able to give a reason as to why you would ask the health officer to step down?
No, I think that personnel issues are not something that should be discussed that way. I mean, I'm not at liberty to talk about that under the advice of counsel.
I have a question for Ben Wick, chair of the health board. This is Rebecca White from the Spokesman Review.
Morning, Rebecca.
Good morning. So what role, I'm hearing that the Board of Health made a recommendation during this executive session. And so what role did individual members have in making this decision? And was there a consensus that came together during this session that all elected officials agreed that the health officer should resign?
So we can't discuss executive session, but the Board of Health fully supports the decisions made by Amelia Clark.
And so did this decision stem from Amelia Clark, or did this decision stem from the Board of Health?
I'm sorry, I can't talk about personnel matters.
Isn't that procedural? How is that a personnel matter?
So the process, or if you're asking about the process, I can talk about that. So our bylaws do indicate that you know, in this case, so for example, of the health officer, the supervisor, who is me, the administrative officer, I have to seek the board's support in this. And that is what I did yesterday.
This is Melissa again from KXLY. We're hearing that the staff, particularly the epidemiologists, are extremely concerned with this decision. Some are already possibly trying to fight to get him back. We've heard possibly the union is looking at action. The epidemiologists being out of pocket during a pandemic is extremely concerning to the community. Can you just talk about the reaction and how the staff has responded to the announcement so far?
I don't know that I'm going to go into staffing. I think, you know, I have let staff know through the announcement and through follow-up communication that I'm available to talk with them, and that, you know, we have many resources and supports available for the employees of the health district, and they have access to those.
Amelia, this is Ariel with the spokesman. When were employees notified of Dr. Lutz's either resignation or termination? I'd still like some clarity on that. When were employees notified of that? And when was the executive team of the health district notified of that?
The executive team was notified yesterday evening. And then this morning I notified staff. I did, and I sent that out prior to 8 a.m.
So were staff told that Dr. Lutz resigned or that he was terminated?
Well, I think you have a copy of the email that staff have sent to you of all my communication.
Amelia, this is Kevin Kim with KHQ. Currently, one of Dr. Bob Lutz's roles was he would literally sign these letters that would go out if a student had been infected with COVID-19. Whose signature is going to be replacing Dr. Bob Lutz's signature?
We are working on that to have a decision related to all of those processes and procedures. That's part of what we're working on today. It will most likely be our medical director from treatment services.
Just for clarification, there's no one at this point, so no decision has been made. So at this point, nobody.
No, I wouldn't say that. I would say at this point, we have an internal person who's working to help us on that. But in terms of a full plan and what I've already been in communication with some of the superintendents to make sure that we have that process in place. So, you know, we have someone internally that can help us with that at this time.
Do we have a timeline on when these decisions will be made? I know you guys are meeting later today, but when can the public expect an actual decision?
For what? For the new health officer?
Yes, ma'am.
Or the coverage for the letters?
I mean, I guess, tell me if I'm wrong, part of me was assuming the new health officer would take over signing instead of Dr. Lutz, but are we discussing a possibility of just reworking the system as a whole?
Yeah, no, what I had mentioned earlier is that I'm in the process of identifying someone that we can contract with until we get the recruitment process finalized so that we continue to have someone to cover. So I want to make sure that I clarify that someone on contract would not necessarily be the next health officer.
Amelia, this is Mayor again from KXOY.
Okay, hi.
So from my understanding, to remove him from his role, there would have had to have been a vote taken place by the board in a public session, not executive. Is that wrong?
I'm going to have Ben Wick assist with that.
Our bylaws actually say that the Board of Health has to approve or concur with the executive directors or administrative officer's decision.
So the board and the administrator, Amelia Clark, all approved the resignation of Dr. Bob Lutz.
Yes, I took my action yesterday with the full support of the board.
And so they did this, sorry, this is Rebecca with the spokesman again. So this decision, which is an action, did happen in a meeting that was not open to the public. So an executive session?
No, during the executive session, I brought forth my concerns. And again, like as Chair Wick was stating, it doesn't take a vote in this situation.
Just one clarification, and maybe this has been discussed, but we're getting texts from community members and employees as this is happening that say no testing or immunizations or anything COVID or public health related can take place without his orders. So who will sign the orders? And if you don't know, how has that not been determined before this action was taken?
Yeah, that's actually incorrect. We have, as I said, a physician here in our office who is taking care of orders and vaccines and testing for us until someone from that we can contract with is here.
Is that an interim health officer?
Excuse me?
Is that designated as an interim health officer then?
It is not.
This is Sam.
Who has the authority?
I think Kelly's.
Sam, yeah. Sam, if you have a question, just because I don't think I've heard from you with the Inlander, but otherwise we need to end the press conference. So
why?
Yeah, one more question, I guess, if you're going to let me do it. With cases spiking right now and no clear person in that role, should it become necessary to put more restrictions on the community to reduce infections, who would be making that decision?
Yeah, that would be something that we would work with the State Department of Health on.
Amelia, I have one more question. This is Whitney calling from CREM. Just curious if he is able to talk about this termination. Was there any kind of severance package or a non-disclosure?
Yeah, that's a personnel issue that I can't discuss.
Okay, thank you, everyone. And you know how to reach me if you would like to send me follow-up questions. I'm happy.
Several people still have questions.
And if you are just joining us, we have been listening in to a early morning press conference after the developments of Spokane Regional Health Officer Dr. Bob Lutz leaving his position. If you've been listening in, a lot of questions, trying to sort through some of the confusion. But just to recap some of what we have heard that there was no clarification so far this morning on whether or not Lutz was terminated or resigned. We also heard this statement specifically that he was not our acting health officer any longer. This is being called a personnel issue, a response that was used as a response to a great many number of questions we entertained this morning, citing performance concerns right off the top of this press conference. We heard from Administrative Officer Amelia Clark, who stated that she brought her concerns to the board, that is the Spokane Regional Health District Board. Of course, Ben Wick, chair of the health board, also weighing in saying that the Board of Health fully supported this decision, although as to what that decision, the process of how that decision was made, still a lot of questions left to be answered this morning. We also were clarified upon the fact that currently there is no acting health officer in Spokane County throughout the regional health district. There was a statement, however, stating that following his guidance was still a priority for the district, that saying Dr. Lutz's guidance was previously based on data, and that was the same kind of criteria that would be used in future decisions moving forward, stating that his knowledge of COVID-19 was a benefit to the community. We also heard that the executive team was notified late last evening, that staff with Spokane Regional Health District was informed this morning just before 8:00 a.m. We were also told that they are working currently to find an interim. However, a lot of questions as to what that process is looking like and if there are any candidates, as well as if there are being any entertained candidates from within staffing, a lot of those questions being unanswered. We're going to jump back into that live press conference right now.
That has not happened at this time.
Is that going to happen if he doesn't resign?
That is future decisions to be made, and also something that needs to be discussed within personnel.
Okay, if he is terminated, is that an action that you think has to happen in public?
I cannot discuss that at this time. I am sorry, you guys. If you could please send me your questions, I'm going to
Kelly, nobody understands what's happened. I don't mean to speak for everybody, but he was asked to resign. We don't know if he resigned. We don't know if he's terminated, but we don't have a health officer. This is public information. This is basic.
Yes, and so we're explaining where we are at right now, and we will make sure you're updated as soon as we have more information.
Is that later today? What does that mean?
Yes, thank you. I have to hang up the press conference right now, you guys.
What time can we expect this?
Yeah, will you have another press conference later today?
I will let you know as soon as I know more. Thank you.
Will there be a board meeting later today?
Oh my gosh.
All right, a lot of questions still left unanswered this morning, but we are going to be checking in with our own Amanda Rowley, who is setting up after listening into that press conference live this morning. Amanda, fill us in on some of the details of what we've heard this morning and some of the questions that still have not been answered.
Hello, good afternoon, Joshua. Correct. So yeah, as you heard, very heated end to this press conference. Still a lot of confusion, a lot of questions left unanswered. The big takeaway right off the bat, they did say this was a difficult decision to make, but we still don't know exactly, it's not clear what that decision was. Now, the health district administrator told us that staff were alerted to their decision this morning, and the executive team were notified last night. A lot of questions. We asked in the health district's bylaws that if there's a vacancy for Dr. Lutz's position, the vice chair would then take over as acting health officer. We asked them about that, and many of their responses were they cannot speak to specific personnel topics, and that is why essentially they weren't answering any of those questions. So we don't know at this point who is the interim health officer. However, the administrator did say that they are working on the recruitment process, but they're also going to use internal personnel to take on the health officer's duties at this point. Joshua?
Yeah, and Amanda, of course, when we were first notified of this news this morning, the term resignation was used a lot. However, as that press conference continued this morning, it seemed that that wasn't quite the terminology that was being definitively used. Can you just talk about what it was like to kind of try and get some of those answers this morning?
Right, so what we know is the board sent out a release saying they asked Dr. Lutz to resign, and the health administrator told us that in their bylaws, they were able to speak to this portion, in their bylaws, the administrator needed the support of the board in order to take this action, and this happened in executive session, so this wasn't open to the public. So they did come out saying, Ben Wick, who's the president of the board, did say the board as well as the administrator fully supported this decision. And again, it's really not clear if it's a resignation or termination or what that situation is. But all we know at this point in the verbiage that they gave to us is the board asked Dr. Lutz to resign, and that apparently has been effective as of yesterday night when the board met for that executive meeting. Joshua?
Thank you very much, Amanda. Of course, we have more coverage coming up today on the KREM 2 News at noon. We will also be working all day with our full team to bring you the latest information that we can bring to you on our KREM 2 mobile app as well. But for now, we'll return to your regularly scheduled programming.
This has been breaking news from KREM 2 News. For more information on this story, keep it tuned right here or log on to krem.com.
There's no way this happens unless something bad happened. Yeah. So, well, Monday and Tuesday are going to be fun days. Wow. Wow. Nice tie, by the way. I didn't get to tell you that earlier.